Thank you very much, Dr. Manzoor. First of all, I pay my tribute and very honorable respect for the organizer of Pakistan Academy of Family Physician, especially Dr. Altaf Cheema Saab, who insisted me and invited me with pleasure to let you know about the use of artificial intelligence to solve our medical issues, and this will also aid our patients' diagnosis, treatment plannings, etc. So actually, I am working in this area from last 5 to 6 years, and I can see that it can help our clinicians to narrow-minded the diagnosis. So what are the 4 benefits of this using AI tools? So increase accuracy. The algorithms, the programming tools which AI allows us to use, there is behind the mathematics and statistics, we can use those predefined algorithms to vast amount of medical data. The first benefit, this can deal with thousands and thousands of medical data. It can learn like our brain learns. So that is why the meaning is artificial intelligence. So it doesn't mean this can replace our brain, but this means we can train a certain model which can inherently refining the diagnosis. It can also identify the patterns that might not be easily recognizable by human physician, and it has improved efficiency. For example, if any physician or any clinician or any oncologist, for example, if there's lots of types of patterns of any disease, that each can help us to narrow down the diagnosis. And after that, the human brain can also, you can say, give the better choice for the treatment. So we can have increased accuracy, improve efficiency, and earliest diagnosis. For many of the diseases, earliest diagnosis is very much important. So if any cancer, it is at the 4th stage, and then the patient life is compromised and his quality of life is compromised, then earliest detection of any cancer disease is also very much beneficial, and it can mitigate the serious complication. For example, it can also have a personalized treatment. AI can analyze the large amount of patient data, including genetics and lifestyle, and to provide more personalized treatment plans. So I have a lot of research in this field, but here I can give you examples from already published data of my research. There are I can discuss briefly about 6 case studies. I have applied artificial intelligence to diagnose the psychiatric issues reported in many brain cancers. Brain cancer has also many types. So, and their psychiatric issues like anger, like anxiety is also well reported. So it is very difficult for an oncologist to narrow down the psychological issue, particularly pertaining in certain grade of brain. I have applied machine learning. Machine learning is also a is a branch of artificial intelligence. It can also predict liver enzyme abnormalities if any person is exposed to or chronically exposed to radiation. We can also detect emotions, and this will be also very beneficial for the psychologist to pre-diagnose any psychiatric issue. So we have applied electroencephalogram brain signals, and we have narrowed down and detect the emotions. 4th one, we have also applied decision trees. Decision trees is also a name referred to artificial intelligence branch. It will let you know the decision, and it will categorize the variable and risk factor which we tell the machine. We can also identify the restless leg syndrome with the diabetic patient, and also the very major application which I have applied for artificial intelligence, it can predict the risk factors for the pediatric lymphoblastic leukemia. So these researches are already published, and I have a lot of ongoing research as well. So let me describe these applications in brief. We already know that brain tumor patients are frequently being found to exhibit neuropsychiatric illness, and this affects their quality of life. So what we did, we collected the patient data related to depression, anxiety, personality changes, panic attacks, delusions, and many more. We collected a lot of data, and this data was collected on collaborative research and with the proper ethical committees and reviews. We applied supervised learning model such as neural network. Neurons mimicked the neural networking. So the brain, of artificial intelligence mimics the functioning of our normal brain. And there is an algorithm named support vector machine. SVM are also been frequently applying to diagnose the particular pattern. So machine learning is an effective tool to get clinical pre-prediction from clinical symptoms and risk variable to select a treatment of respective psychiatric disease. So let me give you a very narrowed down and very brief about how AI works. What we do, we apply certain algorithm. We apply certain algorithm of machine learning or decision trees. We learn the model by some mathematics and statistics model by employing and by recognizing the input and output of the machine. When machine will complete its learning in certain minutes of time, and then when we introduce a new output to the trained machine, it will also include certain algorithms, and this will let you the new output. So it depends on the model, how much good it is being trained, how much good the algorithm we have used, and how much we have used the data sets. This all depends, and also we can measure the efficiency and the errors reported. It is not just like we have trained the model and left it alone. We can assess its frequency. The models we have used in all these 6 examples, we have trained the machine up to the accuracy of 90 to 96%. So this is the basics of how we employ the machine. We applied to J48 random forest. These are the model's name actually, and FTing trees with some supervised learning, and we included certain risk factors. This is very brief introduction. We can introduce more risk factors such as age, gender, presence and absence of dementia, depression, and different brain tumor types, and different brain tumor types grade. So we included the classes of new psychiatric diseases, and that was the output that we use as a target. So you can see this table is briefly describing, for example, if there is a pituitary adenoma of grade 2 and 3, so these neuropsychological disorders can be reported. So if the physician will know that this type of grade is reported, and this is the age and gender and biochemistry and many other things, then what type of disorder the patient could have, and so that the patient's psychological treatment should also be started. So these are the accuracies defined, which are mathematics and statistical details. We identify the accuracies in percentage as well as F measures, ROC area, root mean square, and root absolute error, etc. So let me show you a very little branch of a tree, how we grow a tree like this. For example, the tree which we have trained to produce a significant output, it starts from the root. And our intelligent model is describing as that the important factor for the new psychiatric illness is the grade type. And then it will look up the presence and absence of depression. It will also look up the gender. It will also look up the age as well. And it will automatically categorize. This is the root part of the tree, and end of the trees are the leaves. And the leaves will let you know the output of the model, that which type of the neuropsychiatric illness will be present. So this is the conclusion. Based on the model output, we have seen that ML means the machine learning decision trees, will aid the physician in pre-diagnosing the mental issue and deciding on the best therapeutic approach to avoid subsequent neuropsychiatric issues in brain tumor patients. This is exactly one example. This is second example, that how we can apply artificial intelligence and machine learning to diagnose if there is any radiolysis or radio anomalies occurring in the liver enzymes. So what we did, we apply linear regression through a machine learning approach, and while over we also know that liver is a radiosensitive organ. So what we did, I have a collaboration with InMode Hospital. We collected and gathered data through the physician for liver enzymes as well as their exposure to the treatment radiation, because occupational radiation workers are chronically exposed to certain millisieverts of the radiation, and liver is a radiosensitive organ. So it was very important to have some collaboration or have some association between exposed millisievert doses with the effects on the liver enzymes. So we included certain occupational workers who are working up to 10 years on the radiation departments such as nuclear physics, such as radiotherapy, radiology, etc. We used certain softwares and obeyed and followed the rules by ICRP. What we did, we run the test sample, we run the test model on 100 samples. Once the model will be trained, we can vary the data sets and we can get the required output as we get. And it is very much important for artificial intelligence models that we cross-validate the models. So without cross-validation, we don't apply it. So what we did, the levels of ALT were found in the occupational worker, 50% levels were high. And ALT was raised in 25% of the occupational workers. So we can pre-predict or pre-diagnose any individual to save him or her from the other chronic disease. So it can help clinician pre-diagnose any alteration in the biochemistry of an individual beforehand who is being exposed to certain toxin. We can include other toxins as well, not just the radiations. We can, for example, the miners worker who are exposed to certain toxic elements as well. The study 3, we used a digital headband. We used a digital headband for measuring EEG records, and we included certain, these were not the patients, these were just normal human beings who showed their 3 types of emotion: relaxed, neutral, and concentrating. And we collected the data from male, female both, and then we calculated the data was recorded for each mental state. Let me show you. This was the Muse headband. This digitally measures the electroencephalogram, and it has certain sensors. All centers give you the data for different parts of the brain, and when the signals and the patterns we receive from the EEG Muse headband, the digital headband, we incorporated them into the artificial intelligence model, and then automatically it will let you know the mental state of a patient or any individual. So what will be the benefit of this? We applied these 5 models: NIF-Bayes, BiasNet, J48, Random Tree, and Random Forest. These are the names of the models and statistics or mathematics we applied. We already aware the different types of EEG waves, delta, theta, alpha, beta, and gamma, correspond to certain frequencies, and they were received from the digital Muse band. And then we analyzed with the help of our model to pre-identify the mental state of anyone. Then what will be the benefit? Its benefit will be AI-based diagnosis of specific mental state is highly valuable for human-computer interaction. For example, when we use the robots, when the machine starts to learn our emotions. It also allows psychologists to pre-assess any vulnerable mental ailment, to manage any stress or anger, especially in the students or in certain population. So what we achieved 95% accuracy for the model named Random Forest. And these are the feature selection evaluator. Our machines are so much intelligent, they automatically detect the most important feature by itself. And it also depends on our brain that we are working to train the artificial brain. So another case study is related to diagnosis the joint pain. Pain is widely acknowledged to be a very complicated and a painful experience. So we use the complex clinical and experiment data, and the modern computer science will when we just enter the biochemistry of certain person with certain risk factor, it will automatically let you know that the person will be having a joint pain in certain ages or certain phases of life. So the early diagnosis of joint pain can also prevent more serious orthopedic conditions. So these scientists also applied machine learning methods for osteoarthritis related ML research. So we included patients up to certain ages, and we applied certain inclusion and exclusion criteria. We applied the data set into 75%. This means we dedicate certain part of the data for the training and certain part for the data sets to be applied. So we included certain this is a long list, but I am just presenting that CRP, uric acid, etc. can be used as a risk factor. And then we looked certain errors as well. So this is the detail on the errors we can see. From here you can see accuracy is 94%, and accuracy was 96% when we validated the model. So this is also a very simplified form of the decision trees. the decision trees of the random forest automatically exclusively identify that age could be the major factor. It will make two ranges, for example, greater than 84 years or less than 84 years, and then it will classify certain biochemistry parameter which will give him, for example, CRP, then uric acid. It will also look up for the gender, etc. So we have seen that uric acid was found positively correlated with the occurrence of joint pain. And this is most important thing which of AI application I'm going to tell you here. You clinician and physician, you don't need to apply certain models, and you don't need to. The computer scientists can already have a mechanism to deploy all these models as a workable form, in the form of web application, in the form of pre-trained software. So you don't need to do the details of the computer science and all that. We can provide you the already prepared trained model. These can be accessed by physician with deployed model. And we must have, it's a need of hour that our medical system should be computerized. All the patient data should be entered over there, and we can simply apply the science of the computer science. Because of diverse range of potential causes and treatment effect, patients with back, knee or ankle pain are common and present challenge. So there are lots of medical challenges we are facing right now. So we must apply these models. Study number 5. Am I audible? Okay. Assessment of restless leg syndrome in patient with diabetes mellitus through AI. So I will summarize in 1 minute. We have applied a branch of artificial intelligence, multi-layer perceptron. So I can just jump over to the results and images. If someone has interest, I can share the slides. So as per artificial intelligence, the MLP, this is the network. This is the smallest artificial intelligence network. I'm giving it an example. It will end at the presence or absence of RLS 1 or 0. 1 means it will be present. The patient can suffer from RLS, and 0 means it won't suffer. So this is the long list of the risk factor I have present here. And the normalized variable importance, it was also categorized by the AI. So knee to the move was as 100% as a risk factor for the RLS. And our study 6 is related to predicting environmental and biochemistry as a risk factor for child ALL. And just I can jump over the summary. We have seen that classification and regression trees provided the best and complete fit for the entire data set with a 99% accuracy. And it also gave us the list of important risk factors in the form of highest to lowest percentages: platelet 43%, hemoglobin 24%, WBC 4%, and gender related to the 4%. And just the last thing, while artificial intelligence has already shown promise in automating certain tasks, it does not seem likely that it will replace the flesh and blood physicians. Of course, our physicians have a more importance than our AI. Of course, the contribution of the family physician is also well recognized. Thank you very much.